cobra. I cut the cash for all my soldiers. I cut the grass, expose the cobras. Yeah, watch me shine through tinted rovers. Then shut the game down like changing.
Hello, everybody. My name is Jennifer Lotito, and I'm the president and COO of RED, the organization co-founded by Bono and Bobby Shriver to bring companies into the AIDS fight. Welcome to our first RED Talk of 2024. This year is shaping up to be a big one for RED, our partners in the AIDS fight. To achieve the most impact, we must drive testing, treatment, and care to those in need. I recently had the chance to sit down with three experts who are leading this work. Peter Sands, Executive Director of the Global Fund, Angeli Achrekar, Deputy Executive Director for Program for UNAIDS, and Dr. Kimberly Smith, Head of Research and Development, ViiV Healthcare, and the sponsor of today's RED Talk. Here's more from our conversation. Peter, Angeli, and Kimberly, it's so great to see you all. Thank you so much for joining our first RED Talk of 2024. Peter, I'd like to start with you. There's so much doom and gloom out there. It's easy for people to tune out. But in the AIDS fight, we've seen amazing progress. Can you talk about the progress that we've made over the last 2 decades and how exactly the Global Fund has contributed to this work?
Well, Jen, it's great to be able to join you along with Angeli and Kimberly. And yeah, you're right. It has been an extraordinary tale of progress. In the 2 decades since the Global Fund was created, we've seen in the countries in which the Global Fund invests, which are all of the highest burden countries, a 72% reduction in deaths due to HIV/AIDS and a 61% reduction in new infections. So that, by any mark, is a tremendous success. Obviously, the job isn't finished. We still had 630,000 people die of AIDS-related diseases last year. We still had 1.3 million new infections. We lost some ground, particularly on the prevention side, during the COVID pandemic. We actually did, as a global community, a pretty good job on keeping people and sustaining and growing the numbers of people on treatment. But prevention got very disrupted due to the closure of schools, lockdowns, and all that. The Global Fund has been a key player alongside UNAIDS, PEPFAR in driving this progress. And ultimately, and most importantly, the frontline workers, the health workers themselves, but also the community leaders and activists who play such a crucial role in delivering services to the people most vulnerable to HIV infection and those who are HIV positive. So we've invested about $30 billion over this period in the fight against HIV/AIDS. So in short, it's a story of tremendous progress that proves it can be done, but it's also an unfinished story with a lot more for us still to do.
Absolutely. Those are incredible numbers, Peter. Thanks so much for sharing. I'm going to next pull in Kimberly. First, before we get into it, Kimberly, I want to thank you. I want to thank the team at ViiV Healthcare for sponsoring today's conversation. So where have we made the biggest gains in the AIDS fight, and how has ViiV Healthcare contributed to this progress? Kimberly, I'd love to hear from you.
Well, thank you. So ViiV Healthcare, just to talk a little bit about the company, we are the only global healthcare company that's 100% focused on preventing, treating, curing, and ultimately ending HIV and AIDS. And we're really proud of the contributions that GSK and ViiV have made to the HIV response over really the last 40 years. And, as Peter described, the progress has been incredible. As the head of research and development, certainly for me, it starts with the science. And what the science has done is deliver incredible medicines that allow people who are living with HIV to live long, healthy lives with lengths that are comparable to people who are not living with HIV. And so we're really proud of that innovation and the progress that we've made in both HIV treatment and prevention. That progress is grounded in listening to the voices of, the people who are most impacted, the communities, hearing what they have to say, and answering the challenge of going beyond just effective medicines that can get the virus down to effective medicines that actually are easier for people to take and actually make people's lives better. And so we're very proud of that progress. But there's still a lot of challenges. There are still tremendous challenges. Stigma is actually one of the challenges. As much as we've made tremendous progress in treatment, we haven't made great progress in addressing stigma. And, we as a company are committed to that as well. And so not only do we offer medicines that maybe allow people to be treated more discreetly, but we've created programs that help to challenge stigma. One example of that is HIV in View, which is a campaign where we partner with 5 individuals around the world who have major social media following, and we work with them to get key themes around addressing stigma that can be communicated to others, and it just really to put their voices on blast as much as possible. We also have our organization, Positive Action, which is ViiV's grant giving program. And it's been around for more than 30 years, and it has been working alongside the communities most impacted by HIV to basically address those challenges that those communities recognize. And then I really can't not emphasize our important partnerships with the Medicine Patent Pool, which it allows us to partner with generic companies to make our medicines available. And so as a result of that partnership, 21 million people around the world, particularly focused on resource-limited settings, are able to use a generic version. And so, those partnerships, those voluntary licenses allow coverage of 94% of adults and 99% of children who are living in low and middle income countries. And so that kind of progress is exactly what, a company like ours is committed to doing and making a big difference in partnering to get to the end of this epidemic.
And it's truly incredible. And I'm so glad we're having this conversation because the world needs to know that. And when you think about the trajectory of the AIDS fight, that feels unfathomable, everything that you just described. So I'm really happy to have you here and sharing that story with us. I want to turn next to Angeli. So we know UNAIDS released a new report earlier this year detailing the state of the epidemic. Angeli, can you talk about where are we today in the AIDS fight and what are some of the big breakthroughs that you're seeing that are having the biggest impact on the fight?
Sure. And thanks, Jen. It's such an honor to be here talking with you all and to be on a panel with Peter and Kimberly as well. So I just want to say thanks first. And you're right. UNAIDS did release, and we release every year, a state of the globe, the progress of what is happening in the HIV/AIDS response. And what we're seeing, and Peter mentioned this, what we're seeing is nothing short of extraordinary. The progress, again, without a vaccine or a cure, the progress in the HIV/AIDS response is extraordinary. I mean, it's one of the greatest success stories of all time, surely of our time, of our time. What the report notes is that it shows trends over time. And what we see is that AIDS-related deaths have declined by nearly 70% since they peaked in 2004. New infections have been reduced by 60% since their peak in 1995. This kind of progress really demonstrates the power of partnership and the possibility of what is in front of us if we all work together to deliver those solutions in a coordinated way at the country level. And again, this is all without a vaccine or a cure. So the progress is really, really breathtaking when you see what's happened at the peak of the pandemic and where we are now. We know that lives have been saved. Of the 39 million people living with HIV, we have nearly 30 million people on treatment. And this is a life-saving treatment. This is a collective effort by, the Global Fund, by PEPFAR, by country governments, by communities, by private sector partners, all of us coming together to bring solutions to people in need. That, again, is extraordinary, and it's resilient. You know, in the wake of COVID, where we saw real challenges in the health system, we've still been able to withstand those challenges, and we're withstanding climate change and other issues to continue to make sure that the AIDS response is moving forward. In terms of, I just would like to say one thing in terms of the gaps, though. Despite the progress is fragile. We have to make sure that we are continuing to make the gains that we've seen and sustaining the gains. When we look across the globe, what we also share in this report is that there are real stark gaps with children. They fall so much farther behind, for example, with adolescent girls and young women, with key populations. And for some of the reasons that Kimberly just mentioned related to stigma and discrimination, that's why we're in this conundrum and these gaps are not yet met. So again, with the progress, which is extraordinary, that's something to be celebrated, but we have to double down with urgency on where the gaps are.
Well, thank you so much for that. And I want to pivot because you both have talked a little bit about the challenges, especially around stigma. Peter, I want to turn it over to you as we think about obstacles and challenges to this fight. We know that stigma remains a big issue, both from a society standpoint and self-stigma. Peter, can you talk a little bit about how do we combat this major issue?
Yeah, you're absolutely right. And both Kimberly and Angeli mentioned stigma and discrimination. I think we're increasingly in a position where we have great tools. We don't have a vaccine or a cure, as Angeli said, but we have increasingly powerful tools that allow us both to prevent people getting infected, and if they are infected, to allow them to live long, happy, healthy lives. But none of that works if the people who need the health services are too scared to get access, are prevented from getting access, are too stigmatized or criminalized or discriminated against in other ways. And that is the reality, is that we are still in a situation where in too many parts of the world, men who have sex with men, transgender people, sex workers, people who inject drugs, prisoners, some of the people who are most vulnerable to infection are prevented from getting access, either by legal means or by just informal social stigma and discrimination. And it's also true of adolescent girls and young women. People forget that the leading cause of death of women aged 18 to 45 in Africa is HIV/AIDS. And that's because adolescent girls and young women in too many places are subjected to gender-based violence, economic disempowerment, educational disadvantage, real deep structural gender barriers. So increasingly, the fight against HIV/AIDS is, yes, powered by all the fantastic technologies that ViiV and others have brought to bear, but it's also about tackling these structural issues, these fissures within our societies. And we have to face up to the fact that if we don't confront those, we won't win. And increasingly, we're facing a pretty challenging context in which to be doing that. So collectively, as the sort of HIV/AIDS community, we have to step up our efforts around combating stigma, combating criminalization, discrimination, the barriers to access that will prevent the people who need support and services from getting what they need.
So we know we can't end AIDS without targeting resources to marginalized communities, and we've heard a lot about that today. And we can't talk about ending AIDS without talking about women and girls. Angeli, can you talk about why it's so important that we focus on this important demographic?
Sure. Thanks so much, Jen. And just as Peter and Kimberly said, you know, we have made incredible progress across the globe, but when you start disaggregating the data and really looking at subpopulations, we are leaving certain populations behind. We are failing generations by not addressing structural barriers and some of these other access to services that Peter mentioned. Last year, while releasing this report that I talked about earlier, we also sounded the alarm that we are failing to reach these key populations, adolescent girls and young women and children. And it's really because inequalities are driving this fissure and this gap. And it's particularly true for adolescent girls and young women. Globally, every week, 4,000 adolescent girls and young women acquire HIV. In sub-Saharan Africa, that's 3,100 adolescent girls and young women. That's one young woman, one adolescent girl every 2 minutes that is newly infected with HIV. Why is that? It's because of the gender-based violence, the stigma, the structural barriers, the economic disempowerment that Peter mentioned, the lack of access to services, issues that are larger than delivering HIV biomedical solutions to these women. So we've got to grapple with and tackle head on the structural barriers that are preventing adolescent girls and young women of reaching the services that they need. And we have incredible tools, like Peter and Kimberly have said. We've got, pre-exposure prophylaxis to prevent new infections. We've got the depivaring ring. We've got, treatment. But these tools and these solutions are not accessed in the way that they need to be by adolescent girls and young women. So we've got to work differently to tackle those structural barriers and those gender inequalities that are standing in the way of adolescent girls and young women getting the services that they need.
Well, thank you. And speaking of working differently, Kimberly, I'm going to turn it to you because GSK and ViiV Healthcare recently partnered together with the Global Fund to launch a multi-year fund that specifically focuses on gender equality. Can you talk to us a little bit about this partnership and why addressing these inequities is so important?
Well, I absolutely want to talk about the partnership, but before I do that, I really want to emphasize sort of the importance and really, Angelique brought it up. We have great biomedical interventions, but we have to get them to the people who need them. And so, I think one great example of a really, I think, revolutionary biomedical intervention is long-acting prevention. And we did a very large long-acting prevention study in South Africa that was focused on cisgender women. And we enrolled those young women, young adolescent women. And I had the great opportunity last year to go to South Africa to one of those clinical trial sites and meet some of the young women who participated in those trials. And it was tremendously motivating how much courage they had to participate in these trials, to actually manage staying in the trials despite COVID. And when I spoke with one young woman in particular, she just talked about feeling empowered by being a part of the trial and taking on the need to have prevention options for her community herself. And that really was it really motivated me. I mean, this is an area where we have a tremendous amount of passion. And as Angelique and Peter mentioned, when we talk about infectious disease epidemics, they are all too often driven by inequalities, poverty, poor nutrition, discrimination, intimate partner violence. All of those things impact women disproportionately. And so those numbers that Angelique mentioned in women in sub-Saharan Africa should be disturbing to all of us. The fact that 63% of all the new infections in sub-Saharan Africa are among women is absolutely disturbing, and it's an area where we need to lean in as much as we possibly can. young women and adolescent girls are being left behind, and we have to do everything we possibly can. And so we have to address these health disparities, and that's why we are so excited to announce this partnership, this collaboration with the Global Fund and GSK. ViiV and GSK will provide a combined multi-year commitment of $7.5 million US dollars towards the Gender Equality Fund. And we're delighted that our joint contribution will also be matched by the Bill and Melinda Gates Foundation, with their funds going towards the Global Fund to support this mission more broadly. This is the way that we address this disproportionate impact on women. We have to come together with the community to use funds like this to allow the community to lead in developing programs that they know will impact their communities most effectively.
Well, thank you for that. That is a massive commitment. So very grateful to you for that, and look forward to hearing more on that. So I want to turn our attention now to the future, where 2024 is going to be a big year for RED and the AIDS fight. What I'd love to do is have each of you share some of the big moments you're paying attention to and what's really giving you optimism as we start this new year. I'll start with you, Peter, and then I'm going to go to Angeli and Kim. But Peter, starting with you.
Well, to start with, I want to acknowledge and thank Kimberly, ViiV, GSK, and by extension also the Gates Foundation for their fantastic support of the Gender Equality Fund. Before we get to 25, there's one date in 2024 that I'm focused on, which is World AIDS Day. It's an opportunity both to commemorate I think it's now, Angeli, 40 million people who've died of AIDS-related diseases. I mean, that is a staggering total. And while we talk about the progress, we must also recognize that extraordinary human cost that we've suffered. But also World AIDS Day is an opportunity to kind of recommit and re-energize around what we need to achieve. And I think the focus of this conversation around prevention, around making sure that people get the innovative new tools that are now being made available, around gender equality, around the rights and access of key populations. In a way, I don't see them so much as moments, but as challenges and tests. We want to be having this conversation a year from now and saying we've made real progress on these things, because we don't have time to waste. And people's lives are being lost, and people are getting infected in ways that, frankly, we could prevent that happening. So that's how I'm looking at 2024. I see it as a year in which we have to move the dial very significantly on the prevention of new infections, because ultimately that's how we're going to beat this disease.
Absolutely. Angeli, over to you. What's giving you optimism in the new year?
What I'm excited about when I look to the next year and the new year is it comes back to the partnership. It comes back to the unique partnership that we all have in the HIV response. Never, ever has the world come together in the way that it has, as it did for the HIV response. Multi-sectoral, UNAIDS, Global Fund, PEPFAR, communities, country governments, private sector, faith-based organizations. Never has the world come together in this way. That is what has delivered the success so far. You know, I think about where we are, and we are halfway. Next year we'll be halfway in terms of where we are getting to the 2030 Sustainable Development Goals. Those Sustainable Development Goals that the entire world has committed to is really important for all of us to focus on. What we see is that SDG 3.3, the one we're all focused on, which is HIV, is the only one of all 17 that is actually moving in the right direction. That is something that is happening because of the unique partnership that we have, the data-driven focus that we all have, and the engagement with communities and countries in the way that we do. And so I'm looking forward to 2024, as Peter said, to double down on what we know works, to bring urgency to closing the prevention gaps that we're seeing. We must accelerate on prevention, and we're looking forward to doing that together. And that means, yes, bringing the biomedical solutions to bear, but also addressing those structural barriers that are very challenging. I'm also looking forward in 2024. I think we can get to closing the treatment gaps in children for once and for all, and we've got to do it. So I'm looking forward to real sustained action in 2024, because we can and should get there.
Absolutely. Kimberly, I'm going to give you the last word. What's giving you optimism in the new year?
What's giving me optimism is that while there have been challenges, we have been good at addressing them, and that now, there are some 28 million people that are on treatment, but that means that there's 10 million or so that aren't. And so we have a whole lot of work to do to get those additional 10 million on treatment. That's so important for those 10 million themselves, but also for getting to the end of the epidemic. We know that U equals U. So if we can get people on treatment and get their virus suppressed, they don't transmit. And so that's a big part of the prevention agenda. In addition, we need to get more PrEP rolled out. And I look forward to seeing a rollout of all the different PrEP options across different communities, so that we can empower people with many, many options to protect themselves, and really empower young women in particular. At ViiV, we have a clear mission to leave no person living with HIV behind. That drives us. We're motivated. Our commitment is not coming to a close. It's only getting stronger. And so I absolutely look forward to us accelerating the fight to get to the end of HIV stigma, and work closely with our partners and the community to really change the trajectory of this epidemic.
Well, Kimberly, I'm so glad to be in the fight with you all. There's clearly some themes that are emerging from today. But, Peter, Angeli, and Kimberly, I wish we had more time, but unfortunately we don't. But it's been really great to hear all of your input and all of your smart thoughts. And I just want to thank you so much for a really great conversation.
Thank you, Drew.
Thank you so much, Jen.
My sincere thanks to Peter Sands, Angeli Achrekar, and Dr. Kimberly Smith for joining me today. And thanks to ViiV Healthcare for sponsoring this episode of Red Talks. While we've made incredible progress in the AIDS fight, our work is far from over. Red is doing our part by partnering with the world's biggest and brightest brands to drive life-saving testing, treatment, and care to those in need. We can't wait to share all of the exciting work we have planned, and hope that you will join us. Be sure to follow Red on social media for the latest and greatest, and stay tuned to this channel for our next episode of Red Talks. Thanks so much for joining, and have a great day.